going to go ahead and start. I'm going to introduce Ryan today. He is with Chandler Support Services, and they have served individuals with intellectual and developmental disabilities in Northeast Florida for over 20 years. They are a fully licensed and insured provider through APD and a member of the Association of Support Coordination Agencies. Their team uses a person-centered approach to help individuals and families reach their goals. And then I just want to plug on a personal note, my family uses Ryan services for our daughter. So we are going to talk about consumer directed care, CDC Plus, and we have a presentation. And if you would put questions in the chat, we can answer as we go along, or you can raise your hand and we can answer it that way, and then definitely open it up at the end for question answers. Does that sound okay, Ryan?
Sounds good to me.
Do you want to go over a little bit more of your background before we start?
Sure. My name is Ryan Chandler. I am agency owner of Chandler Support Services. We provide support coordination and consultant service, CDC Plus consultant services in the Northeast region. So Jacksonville down to Flagler, over to Gainesville, up to the Georgia border. I've been a support coordinator for almost 24 years now, a CDC consultant since the beginning of the pilot program, which was about 23 years ago. I'm also the president of the Association of Support Coordination Agencies, which is a statewide membership of support coordination agencies who participate in legislative activities. I go to Tallahassee frequently, like Alan is now, and meet with people and try to improve the situation for people with developmental disabilities and providers providing services to people with developmental disabilities and their families. So thank you very much.
Well, great. Okay, so let me do this. I am going to share my screen. And let me know if you can see it. Hang on a second. All right, can everyone see that? Ryan, can you see it?
Yes, okay. I can see that. Thank you.
Okay, cool. All right, well then just let me know when you would like to. All right, we're going to go to the first slide. Okay.
That's good. Thank you, Dina. All right, so as I said, my name is Ryan Chandler. I am a agency owner, support coordinator, and CDC consultant, and have been providing CDC Plus consultant services since the beginning of the program. And that's why I have history as the first slide. The CDC Plus program originated as a pilot program about 23 years ago as an option for any consumer not in a group home who is currently receiving home and community-based waiver services at that time. I actually had 3 individuals on the pilot program, and it was very advantageous to them. And I'll get into more of why it was helpful to the family later on in this slides. But the APD and the Agency for Healthcare Administration deemed that the pilot program was successful and approved it to move forward as a federal waiver program. And the program puts more control in the hands of the individual and their family. Next slide, please. Okay, some of the benefits of the CDC Plus. The CDC Plus is a long-term care program alternative to the Medicaid home and community-based Medicaid waiver. The program provides for the opportunity for individuals to improve the quality of their lives by being empowered to make choices about supports and services that will meet their long-term care needs to help reach their goals. What the CDC Plus does, in essence, is it allows the individual receiving services to use providers outside of the home and community-based services waiver network of providers and direct their own care. So what that means is, instead of having to use traditional waiver providers, which is a network and it can be limited in certain services, individuals receiving CDC Plus services can hire family, friends, other agencies in the community. I have some families that look for providers on nannies.com, care.com. It really opens up a lot of other options to people, and so that they're not limited within that waiver network of providers. That can also be helpful in a service, for example, behavior analysis services. There's a very limited amount of behavioral providers in the waiver program. There are always wait lists. It's a very hard service to find, but there are a lot of other behavior analysis services providers out there that choose not to provide services under the waiver. So using the CDC money, you can go outside of the waiver network and find one of those agencies that's not a waiver provider. I wanted to use this opportunity too to talk about a slide I found on the CDC Plus website, just to outline some of the benefits, but also the risks of using family and friends. And I thought it was kind of interesting and a little funny, but some of the benefits of using family and friends is that they're easier to find. You know them well. They can be more affordable because you don't have to pay the traditional waiver rates. You can pay a lower hourly rate, which would increase the amount of services you can have. And then those family and friends could also, in some instances, be live-in, so they're always readily available to provide services. Some of the risks of hiring family and friends is, and this is the interesting part that I found on the website. Family and friends can be harder to fire, more difficult to manage, and might make their own decisions. So it kind of puts the different roles could be at odds with each other in those situations. The third benefit I have of the program is that unused funds that you receive through the CDC Plus program roll over month to month and fiscal year to fiscal year, resulting in an accumulation that if the account's not exhausted each month. So if you're not using all of your services every month, it rolls over to the next month and you can use more services that next month. And I have some families that have a significant surplus to do things that they might not otherwise be able to do under the waiver. This differs from the waiver in that funds under the waiver are, if they're not used at the end of the fiscal year, are returned to Medicaid. And the CDC Plus does reserve the right to reinvest those CDC Plus funds back to Medicaid by taking a portion of the accumulation. But this is very, very rare, and only in extreme surplus situations. In the 23 years I've been doing this, the CDC Plus has only reinvested on a few of my families, maybe 2 or 3 times. So it doesn't happen very often, but that is a huge benefit, because under the waiver, you lose the funds you don't use at the end of the fiscal year, which is June 30th. But on the CDC, they keep rolling over and building if you're not using them all. Next slide, please.
Oh, okay, let's see. Crystal, I just noticed your hand raised. You can unmute yourself. And do you have a question?
Yes. For Ryan,
Mhm.
I live in a group home, and with HCBS waiver
Mhm.
to CDC Plus, I have Medicaid and Medicare, but it's just my insurance is going to change. Can you do anything about it?
I can't do anything about that. If you have a support coordinator, I would speak to them about that issue. Also, I noticed you mentioned that you live in a group home. That's actually the first bullet point on this slide is, that's the only living setting that is not eligible for CDC Plus services. So people in supported living and family homes can opt to transition from the waiver to the CDC, but individuals in a group home setting, that's not an option.
Okay. And I'm sorry to interrupt, but it's just I've been there for 3 years in a group home, and because now I am a first and board rep for Stand Up for Independence, and I'm trying to get everything situated with me.
Okay. Yes, that's something I definitely talk to your support coordinator about so that they can help you.
Thank you, Ryan.
Good question, Crystal. We have one other, and this, you may be covering this later, Ryan. So Sandra wants to know, what procedures do I need to follow in enrolling my son in the CDC Plus service?
I will be addressing that later. There are also some attachments that are going to go out to everyone. And one of the attachments is called a welcome packet. And there are actual active links in that PDF. So the links will be blue, and you'll be able to see the application packet and the enrollment packet and instructions and everything that you need to apply and enroll on the program. And I can also, I'm going to put my contact information also, if I can help at all in that process.
Great. So hang tight, Sandra. We'll get there.
Okay. So transitioning from the home and community-based services waiver to the CDC Plus, as I stated, the only living setting that's not eligible to transition to the CDC Plus is anyone receiving residential habilitation, which means they're living in a group home and the waiver is paying for that service. Supported living and family home people in those living settings are both eligible to transition to the CDC Plus. The application process for transitioning includes paperwork that turns the individual into a household employer. And that's where I say see the welcome packet attachment and links. And what the term household employer means. So any business, when they hire someone, the taxes are run through that business's employer identification number, or EIN. When you have a household employer, it takes the person's social security number and turns it into an EIN also, so that people's taxes can be run through that individual household employer. And then when moving to the CDC Plus, the consumer's budget is reduced by 8%. The reason for that is there was a company many, many years ago when this was getting started, and the company was called Mercer, and they did a rate study, and they determined that individuals on the waiver use 92% of their budget on average. So basically the cost of going to the CDC Plus program is your budget's being reduced by 8% because of that study. The CDC Plus also charges 2 to 4% in administrative fees, which pays for the cost of them having to manage all the payroll information, running the taxes. There's a lot that goes into doing that, the W-2s, W-4s, 1099s, everything at the end of the year. And that 2 to 4% I have in there, that spread is dependent on the size of the budget. The consultant fees are also removed from that. And then the budget's divided by 12, and a monthly deposit is received by the consumer from Medicaid to purchase services and goods that are deemed approved and necessary. Next slide, please.
Hang on one second. Lily,
Okay.
did you have a question? You have to unmute yourself. Let me see.
Yes, but I guess I could wait till the end. It was regarding leftover money, but I'll wait till everything is done and see if he addresses it or.
Okay, great.
Thank you. I'll wait.
Thank you
till-
very much.
You.
Okay. There are several roles in the CDC Plus program I wanted to outline. The consumer, that's the individual who is receiving waiver services. That is the person who the support plan is written about, and the cost plan has services to address those needs and goals. So the consumer is the individual receiving the waiver services. Now, I have the next role as representative if needed, and I wanted to just go into why I put if needed there. If the consumer is able to perform representative duties on their own, and that includes writing purchasing plans, doing quick updates, which I'll get into all that terminology later, keeping timesheets and invoices, participating in the audit that can be random at the end of the year. If the consumer is capable of doing that on their own, they do not need to have a representative. Most of the time, in the families that I work with and the population that we serve, a representative is needed. But they do have that caveat if the consumer is able to manage those things themselves. So the representative is a person designated by the individual, the consumer, or the guardian, if applicable, to act on their behalf for the purposes of the program. So then the representative's the one writing the purchasing plans, the quick updates, participating in the audit, doing all those technical things. The next roles are employees, independent contractors, and agency vendors. Those are the three types of service providers that can be hired by the consumer or the representative to provide services to the consumer. Next slide, please. Roles continued. There's the consultant, which is what I do, and it's a waiver support coordinator who has also completed the CDC Plus training. And what the consultant does is assist with enrolling or disenrolling from the program. And one thing I want to mention when I say disenrolling, if the CDC Plus ever did not work out for a family or an individual, that person can always transition back to the waiver. That's very important. I've had a lot of people ask, well, if I go to the CDC, will I lose my waiver services? And it's that doesn't happen. You are always able to disenroll from the program and go back to the waiver. So the consultant assists with enrolling and disenrolling if necessary, providing technical assistance in writing purchasing plans and quick updates. We're not supposed to do it for the families, but we're supposed to be very helpful, and my agency is extremely helpful in doing those things for people. We review the submissions to make sure there are no errors before we submit it to the next role, which is the regional liaison, and that's local APD staff who then reviews the purchasing plans, quick updates, and information that I submit. And if they approve it, it goes to a CDC Plus reviewer, which is APD and CDC Plus staff in the state office in Tallahassee. And they review those requests and either approve or deny them. The final role in the CDC Plus program is the fiscal or employer agent, and that's certain CDC Plus staff in the state office who perform the payroll duties, the taxes that I mentioned, the things at the end of the year pertaining to taxes, all the payroll related duties. Next slide, please. Okay. I mentioned in a previous slide the three service provider categories on the CDC Plus. There are directly hired employees, and these are W-2 employees who have taxes taken out They, when doing it, you have to do a W-2, I-9, all the things that someone going to apply for a job would have to do so that the program knows how they're classified tax-wise, married, filing jointly, single, all those things. It's a W-2 employee who has taxes removed. The next category is independent contractors, and that is either an individual or a sole proprietor who chooses to be a 1099. So you can hire 1099 employees or basic 1099 independent contractors on the CDC Plus. And the benefit of that to the CDC Plus consumer is that taxes aren't taken out. So your budget's not being used to pay those matching taxes that an employer has to pay for a W-2 employee. The third category are agency vendors, and that's an established business in the community who provides various services to individuals. And they also, when you use them, there are no taxes taken out of your budget in those cases. Next slide, please.
We do have a question. They're asking for you to please clarify consultant technical support. Not requiring the consultant to complete or make the decisions. Also the importance of monthly reconciliation.
Okay, so technical assistance that the consultant provides would be everything from answering questions when someone's trying to write a purchasing plan or a quick update to assisting them with enrolling. And I'll get to this later. The representatives all have to enroll in the background screening clearinghouse to be able to background screen employees and contractors. So assisting with that, what else? We assist people a great deal if they ever get randomly selected for an audit by making sure they have all the documentation that they need. We teach people how to do reconciliations, which is supposed to be done at the end of every month. And that's basically just keeping a checkbook. You have a deposit and you have what you spent on services, and then you have an ending balance. And there's a particular reconciliation form that CDC Plus likes us to use for those, but they do allow people to do their own reconciliations as long as all the criteria are met. Did that answer the question?
I think so.
Okay.
Okay. All right. Let's see.
Okay. All right. I mentioned the background screening clearinghouse. So when you are employing someone on the CDC Plus, they must be able to pass a DCF level 2 background screening. The representative or the consumer, if there is no representative in those very limited cases, must apply to the background screening clearinghouse to be able to screen employees and independent contractors in their own account. This is one of the trickier aspects of becoming enrolled on the CDC Plus, but a good consultant will be able to easily guide you through the process because as an agency owner, we use the same clearinghouse if I were to hire a support coordinator or a consultant. So I'm very familiar with the background screening clearinghouse, and I'm able to provide that technical assistance to walk people through that process. I also need to mention there is also training on the CDC Plus website that you can follow to learn how to do that. And then any service provider on the CDC Plus must be able to pass level 2 background screening. And then all the employees that you have working for you must be rescreened every 5 years to be in compliance with the program. Next slide, please.
Crystal, did you have a question?
Yes. With the CDC Plus website training. Does it? I have a mom, and does she need? Does she need to have to do that?
It depends on what role your mother would play in the CDC Plus. If now you are the consumer, if she's your guardian, then she would be making some of those decisions about, enrolling in the program, hiring, terminating employees, what service, different things like that. But it kind of is dependent on the relationship and your situation.
Okay, well, because she's a parent, but I do have a guardian. He's a stepdad. With my stepdad, does my stepdad needs to be trained with CDC Plus?
Only if he was going to be the representative. Only if he was going to perform the representative role. That's the person who does the representative training and then has to take a test at the end to pass to become a representative.
Okay, yeah, because my mom is what's the word I'm looking for? A payee. Does she need a training for that as well?
No,
No?
no, I'm sorry, no.
Okay, thank you.
Okay, thank you. Okay. All right. I had mentioned purchasing plans and quick updates. These are the documents that the representative develops with assistance from us, the consultants, to let the CDC Plus know who is going to be working for the consumer or what goods and services this consumer is going to be purchasing. A purchasing plan is a document that designates who the consumer and representative are going to hire for services and includes employees, independent contractors, agency vendors, and goods purchased. And I'll talk about goods purchased in another slide because that's a different topic. But the purchasing plan outlines the rate of pay and the hours per month that are calculated using an Excel version of the document. So if you think about it, you have a budget and you're trying to fit the services into the budget. So, the rate of pay, the hours the person needs per month, it all accumulates into that budget. So the Excel version of that purchasing plan is very helpful in doing the math for you when you're trying to fit things into your monthly budget. So when the purchasing plan is approved, the CDC Plus adds those approved entities, the employees, the independent contractors, and the vendors, into the payroll portal so that services provided can be added biweekly for biweekly paydays. I wanted to mention that the CDC Plus pays the employees, independent contractors, and the employees and the independent contractors biweekly. Agency vendors get paid monthly. And a purchasing plan must be submitted by the 10th day of the month to have an effective date of the first of the next month. So where we need a quick update is because of that 10th day of the month for the purchasing plan to be effective, basically 20 or 21 days later. Sometimes needs arise that can't wait that long. So a quick update can be done to add the same entities when they are needed more quickly, but there are limitations to a quick update. Quick updates, depending on the region, usually are approved in a week to 10 days if all the documentation submitted is correct. Next slide, please. Okay. I took this from a slide on the APD website. It's also pertaining to purchasing plans. Any item that is allowed purchase using CDC Plus funds must be related to the consumer's long-term care needs or need for community supports as identified in the consumer's support plan. So what that means is all of the services that we request on the purchasing plan have to have a goal on the support plan identified to that service. So before a consumer may purchase services or supports, the services or supports must be approved as being clearly associated with meeting the consumer's identified needs and goals. And a complete list of services available in the CDC Plus program is included in an attachment that is going to be sent to you. It's called the CDC Plus handbook, also referred to as the services directory. And there's an attachment of all the services, a one pager of all the services that are available to people on the CDC. Next slide, please. Okay. Services available on the CDC Plus. There are two categories of services available on the CDC Plus program: restricted and unrestricted. Restricted services are those in the waiver cost plan that must be used as the same frequency on the purchasing plan. Examples include, but are not limited to behavior analysis, PT, OT, speech therapy, dietitian services, nursing, environmental or home modifications, and vehicle modifications. These are considered restricted because they pertain to health and safety, and the CDC Plus does not want someone to go without nursing or behavioral services, for example, to add more of a less health-related service like respite or companion. If someone wants to go out in the community, more often we don't want them not using nursing services to do that. Unrestricted services can be used more freely and include, but are not limited to, in-home supports, respite, PCA, which is personal care assistance, which I'll talk about later, ADT or day programs, companion, supported employment, and supported living. And as I stated, there's an attachment that's going to be sent out with all the services on the CDC. These are just a few examples of the restricted and unrestricted services. Next slide, please. I had mentioned goods, or they call them cash purchases also, or reimbursements. Reimbursements to the consumer / representative are defined. Certain goods and services can be purchased in the retail community and being reimbursed by the CDC Plus to the consumer or representative. These goods and services must be approved on the purchasing plan also and address a goal as well as meet health and safety requirements. The best example of this, or the most common reimbursement, is for consumable medical supplies. This allows a consumer to purchase diapers, wipes, bed pads, inserts, any kind of consumable medical supply from, say, Walmart, Costco, or Amazon, other places in the community where you can find them for less money, which significantly reduces the costs associated with using a traditional waiver provider of CMS. Because when the support coordinator has to go find a CMS provider, a consumable medical supply provider, using the waiver network, those providers, the markup is much higher than going to someplace in the community like Walmart or Costco. And then this savings translates to more funding being available for other desired services such as respite, companion, some of those services that are more desirable than others. But that's where, when you're taking that 8% reduction to move to the CDC, you can really save money by going outside of the waiver network. And that goes for employees, agencies, as well as purchasing these consumable medical supplies. Next slide, please. I mentioned PCA, personal care assistance on the last slide, or maybe 2 slides ago. PCA service is a Medicaid state plan service. It's not a service that's available under the waiver. But for people under 21, a lot of times under the waiver, if the support coordinator goes to APD and says this person's requesting more respite, APD will tell us to go seek PCA services through Medicaid state plan first before asking for more respite. The problem with that is that PCA service, kind of like behavior analysis, it's a very difficult service to find under Medicaid state plan. It's complicated. Each provider has to have a Medicaid treating provider number associated with the individual. It's a very complicated process under the Medicaid state plan. But when someone's on the CDC, that funding can be applied for through Medicaid state plan and can be added to the consumer's budget based on, so PCA services based on conflicts between a parent's work or school schedule and medical limitations that prevent the primary caregivers from providing supervision and personal hygiene, feeding, and other daily care to the consumer. So what that means is if a parent or primary caregiver works till 6, but their child gets out of school at 3, that person could apply for PCA services for that 3-hour gap where the supervision's not there. Applying for these services when they get approved increases the CDC Plus budget and can be used for current employees and vendors. So this is a good way to enhance the CDC Plus budget and be able to use more services, but you're not restricted to using the Medicaid state plan PCA providers that are very difficult to find. And I mentioned that, I already mentioned that last part. So next slide, please. Okay, purchases not permitted on the CDC Plus. The representative is an unpaid role. If that person is performing those duties for you, they're doing it and not getting reimbursed or paid whatsoever. So purchases not permitted are payments to the representative, gifts or loans, rent or mortgage, utilities, lottery tickets, alcohol or tobacco, entertainment activities and devices, swimming pools or spas, educational equipment or supplies, lessons, home and vehicle repairs or maintenance. And I also pulled that information from an APD CDC Plus training slide. Next slide, please.
Quick question, where does,
Yes.
I know that families have used CDC Plus funds to go to Family Cafe.
Yes.
We had some individuals that attended our advocacy days a couple months ago and used, so
Yes.
obviously that can be used. So is there a time, how do they submit to that, and what is the timeline in order to do, like 2 months before the event, or how does that work?
It can be submitted with a quick update, so it can be less than that timeline. I would definitely give it at least a month, to make sure that all the documentation is correct. But for Family Cafe, you can use it for transportation to get there. So I've had people turn in mileage logs from their house to the hotel in Orlando. And I think the reimbursement rates, like, I don't know what it is. I think it might have gone up to 65 cents a mile or something like that. And then also the hotel accommodations there. So they turn in their invoice also for reimbursement purposes.
Now, is that because it's an educational
Yes.
opportunity? And so what do people have to submit? Paperwork on the event, or what do they need?
Yes.
Okay.
They need the event schedule. So the dates of the event, what is going to be covered, and how that's going to meet, a person's goals to be more educated on those topics or, informed in different services. So they have to turn in a schedule of events with the dates of the event. To be reimbursed for the hotel, they have to turn in those invoices and then the mileage log that I mentioned.
Great.
Lily is raising her hand.
Oh,
I see.
Yeah, Lily, go ahead.
You're muted, Lily.
Unmute.
I'm sorry. I've saved my questions for the end, but this one, it's related to what you guys are talking about, and I don't want to lose it. I was never aware of the Family Cafe. This was our first year there, and I was never aware of the fact that there is a reimbursement process, even mileage or anything like that. Are you able to submit after the fact? So you have to submit
No.
before. Okay.
Yes,
But I'll
it
know
has
for
to
next
be-
year.
Yeah, it'll be, yeah. And if you have any questions about that, my contact information will be there.
Awesome. And
Thank you.
and also that would, like, I think Dina just mentioned, I guess that would apply to any event that would be educational and benefit our child, in other words, correct?
Correct.
Thank you.
And I guess you could submit, and by submitting early enough, you would know whether it was accepted or not.
Correct.
Correct.
Thank you.
Okay. Services unique to the CDC Plus. This is very interesting because these are things that are unique to the CDC that are not available on the waiver. The CDC Plus allows for greater flexibility in using your funding. Some examples of unique services that are allowed on CDC Plus but not on the waiver include, but are not limited to, gym memberships, equine therapy, music and art therapy, summer camps, and over-the-counter medications. These services must still be addressing a consumer's goals and pertain to health and safety. For example, gym memberships and equine therapy can be associated with physical therapy goals. Music therapy can be associated with speech therapy goals, for example. Next slide. Okay. Overspending on the CDC Plus. Purchases are supposed to remain within the monthly budget or be able to be accommodated by the ending accumulated balance, which people also refer to as savings, at the end of each month. So I had mentioned how the CDC Plus account balance, if you don't use your entire balance, it rolls over from month to month. So there's a specific direct deposit, and your initial purchasing plan, all the services will remain within, under that budget. But if you start to accumulate a balance that rolls over from month to month and fiscal year to fiscal year, and say a month came along where you needed extra respite or extra companion or extra anything, you can use that accumulated balance to pay for more services than are on your purchasing plan in those months, as long as you have that money accumulated. When you overspend the CDC account, it results in providers not getting paid until the next CDC deposit, which is usually within the first week and a half to 2 weeks of the next month. So if you submit claims that are over what you have in your account, the claims are considered pended, which means people don't get paid. And then once the money becomes available at that next deposit, providers are paid in the following order. They pay employees first, so directly hired W-2 employees get paid first, then independent contractors and agency vendors, and finally reimbursements to the representative. And those reimbursements were what I mentioned when you're buying like consumable medical supplies from Walmart, Costco, Amazon in the community. And then overspending will also result in the CDC Plus requesting that we do a reconciliation to see where the problem is. And if it is not resolved with that reconciliation, then a corrective action plan can be put in place by CDC Plus on the individual or representative. and that reduces the spending until the balance is positive. And what CDC Plus actually does is reduces the number of hours that are available in the portal so that people cannot overspend until the balance is paid back. Next slide, please.
We do have a question.
Okay.
If a CDC Plus individual gets day personal supports as adult respite at a group home, does the personal supports need to be done in iConnect or some other setting before the provider gets paid?
Okay, so if someone's on the CDC Plus and they go to a group home for, like you said, respite, or if they're under 21 or day personal supports if they're over, no, you don't. That is still, and I said someone in a group home can't be on the CDC, but that's when it's their primary living setting. We have people in the family home all the time. If the parents are going to go out of town, certain group homes have respite beds available to people for extended periods of time. That is something you would put on your purchasing plan and pay for out of CDC Plus funding. That's a different type of that, because the group home setting is not the primary living setting. It's just a temporary respite bed. That is still paid for through CDC funding and not waiver funding.
Okay. Lily?
Lily?
I'm sorry. Okay, I understand. I just want to thank you for doing this because you're amazing, and trainings with Larry Hill are nothing like what you're doing. So thank you so much in advance. But you mentioned that if you overspend, which is never my case, but I've heard they'll put a cap on you for up to even 6 months. So I guess what you meant is that unless it could take up to 6 months for the account to become positive again, and
Right.
I guess if you're punishment or whatever. Yeah. Okay.
Yes.
So
Yeah, that's the corrective action plan. It can be up to 6 months. And what they do is they reduce basically the amount of services you're allowed to have over that 6-month time frame to repay the balance. Now, I've had some people that have been on a corrective action plan or a cap, as you said, and they've paid it back in 3 months, and then we're able to sign off on it and send it into them, and they see the balance is positive and the cap is ended. So
how are you ever able to overspend if you only get a certain amount of hours? I don't understand, like it seems like almost impossible, but I guess it gets done.
So the system, yes, the payroll system still lets you put in. Now they have a certain number of hours in there, but it can go over. It allows you to go over. And the reason for that is because if you have an accumulated balance, so you have someone providing respite and you have the funding to cover it, you can go over that amount of hours and it takes it out of the accumulated balance. But if you don't have that balance, you go over the hours, you overspend, the claims get pended, no one gets paid, you do the reconciliation, possibly a cap.
Thank you.
And then let's see. Okay, the auditing processes. The CDC Plus representative or consumer, if they're their own representative in very limited cases, can be randomly selected annually at the time of the consultant. So at the time of my Clarent audit, and Clarent is an entity that's contracted with ACA that comes in and audits all waiver providers. So when it's time for my audit, some of our CDC Plus consumers are randomly selected to also go through an audit. And what they require is the representative to produce documents required to participate on the program. And this also includes, but is not limited to, purchasing plans signed and approved, quick updates signed and approved. And these are plans spanning the audit period. So they do it for a 12-month period. So you have to have all approved purchasing plans during that 12-month period. Background screenings have to be current. And that's a very important one, because if you have someone whose background screening expired, that's considered an automatic alert, and they take that employee out of the payroll system, and you cannot use them any longer until you get a new background screening. And an alert is a higher consequence in the audit than just having something that's not there. They consider that very important because they want everybody who's serving our individuals to be safe. So background screenings are having those up-to-date 5-year rescreenings, all that, and on hand to be able to show is very important. You also have to have the representative also has to have employee and vendor packets, emergency backup plan, the emergency backup plan, support plans and cost plans that span that period, employee timesheets, vendor invoices, receipts of goods purchased, which are the consumable medical supplies we talked about, with the CDC funds, and proof of monthly reconciliations. There are other things that are required in the audit, but a good consultant, they have the tool. There are, somewhere between, I would say, 15 and 20 things, and monthly statements is another one. You have to have the 12 months of monthly statements that they send you. But all that has to be produced at the time of the audit by the representative. And then if anything's not there, you have to do a plan of remediation and produce those documents to APD at a later date. Another form of auditing on the CDC is that the CDC Plus can also request documentation throughout the year to ensure program compliance. And every once in a while, they'll randomly, or if they see a red flag in the payroll portal or something, if they think something might be awry, the CDC Plus can request 12 months of employee timesheets, vendor invoices, receipts for goods purchased with the CDC Plus funds also. So next slide, please. Oh, we're at the end. So the attachments that are going to come out from Dina are the CDC Plus handbook, which is also referred to the CDC Plus services directory. Now that is a very long, it's a couple 100-page document. It's very technical. It talks about the Florida statutes that are involved in the federal waiver things and all, but there's some good stuff in there. There's all the services that are available under the CDC, what the limitations are, the description of the services and what they're supposed to meet. I also attached a list of service codes, and that shows all the services that are available under the CDC. And I lost my PowerPoint. I can't remember the third one off the top of my head.
Oh, I'm sorry. Because I was going to send it out.
Okay.
Yeah, I was just quick editing.
Hold on.
So yeah, we will send out actually the PowerPoint presentation as well, and the 3 documents. We will place this presentation on our YouTube channel for people to share and watch again. So are there, here's a question. What are the responsibilities of the waiver support coordinator versus the representative?
So on the CDC, the waiver support coordinator is called the CDC consultant, which is a very different role from the representative. So the representative is someone that the consumer or their guardian chooses to manage the CDC Plus program for them. They are, like I said, they're unpaid. They're not allowed to be paid to do this. They apply for an account in the background screening clearinghouse to do the background screenings. They write the purchasing plans, the quick updates. They have to be readily available to the consumer if needs arise. They also have to be readily available for that audit at the end of the yearly, annually, if person is randomly selected. The representative puts the times that people work or the reimbursements for supplies, invoices from agencies. The representative puts all those things into the payroll portal. So they have a username and a password. And they go into the payroll portal and do all of those activities. One important thing to remember is the representative. So a lot of times families are doing this amongst themselves. So like a husband can be a representative if the wife is going to be the employee. The representative can't be an employee though, because it's a conflict of interest for someone to be putting in their own times. So that's two very separate roles. You have to have two people to do representative and employee. The representative can't work. The consultant, you had asked, our responsibilities are to assist with enrolling and disenrolling from the program. Like I mentioned, providing technical assistance in writing those purchasing plans that the representative writes or develops. Quick updates. We review those purchasing plans and quick updates within a 5-day time frame, and then submit them to our regional liaison for her approval to send to CDC. We also assist with, if someone's put on a corrective action plan, we assist with developing that. A lot of training. I train people a lot on how to do reconciliations, how to navigate the background screening clearinghouse, because like I mentioned in my slide, that can be a little tricky, and it really helps to just know the ins and the outs of that system. And pretty much just like a support coordinator, we're just supposed to be there for any help that the individual or representative might need.
Great. Margaret, let's go Margaret. And then I do have 2 comment questions, and then we can go back to Lily. We can do it that way.
Hi, thanks, Ryan, for giving us this presentation. I had a question in the chat, and I also have a comment. Can you pay someone more than the Medicaid rate?
Yes, you can.
Okay.
It's out of your budget.
Yes. So the more the more you pay someone, the less hours you're going to be able to fit into your budget. But I have had instances where the consumer may have significant behavioral issues or significant personal care needs, and $15 an hour, which is what the a waiver staff person gets paid right now. So a direct care staff on the waiver has to be paid at least $15 an hour. Isn't going to cut it. So I've been able to ask for $25 or $30 an hour for respite, for example, because the person had significant needs, more significant needs.
Thanks. I have a friend who uses CDC Plus, and she hires students to help her. So I wanted to throw that out there as an idea, particularly medical type students. You can get a good pool of people who are willing to help. And the other thing is that there's a significant amount of paperwork with this program. And I mean, I think from the outside looking in, it's worth it for some people to have to, do that paperwork. And the council, I work for the Florida DD Council, for those of you who don't know me, and we're going to be monitoring any kind of pilots for managed care, and to make sure that this program stays alive and vibrant with any changes that come down the pike. That's it.
Thanks, Margaret.
Thank you, Margaret.
Okay, so we have, what are the requirements during the audits for vendors who provide supported employment?
So I didn't mention this, but when you have agencies and vendors, employees, independent contractors, So under the waiver, agencies and vendors and people providing services were the ones being audited. So, you know, if Clarent comes in and they audit the providers, we have to produce all the documentation that they require to justify those services and make sure we're doing what we're supposed to be doing. On the CDC Plus, the people providing the services aren't being audited. I should put that as one of the other benefits of the slide is on a slide is the providers and the employees aren't audited. The representative is audited, and for agencies, like for example, for your example, supported employment agency, they have to have the monthly invoice from you that they submit to pay you at the end of each month. So that, and they also have to have the initial vendor packet that you submitted to provide services, supported employment services to that person. So, you know, that would be the vendor information form, the W-9, background screening, affidavit of good moral character, and direct deposit form. But the representative is responsible for having those during that audit. Nothing comes back on the agency vendor at all.
Okay, I'm going through, making sure I've got everything. One question, can a father be a payee or representative or caregiver to the consumer and the mom manage the funds?
Yes.
Or
So
vice
those,
versa, I guess.
yep, that's one of the examples that I give frequently. The representative who puts in the times and does the payroll and manages all the paperwork and does all that stuff, the representative can't be an employee because it's a conflict, but a husband and a wife can be a representative and an employee or vice versa. So one can be paid to take care of the consumer while the other one puts those times into the system. And that is, I would say, the most frequent situation that we see.
Okay, what about the 2014-4 form not counted as federal taxable funds?
I'm not familiar with that form, but I think what the question is, so a parent who works for their child, so if the child / consumer is the household employer and there's a parent that's working for that person, taxes are not taken out for that parent. So that's a cost savings to the consumer because the payroll taxes aren't coming out of that budget. So, and that's Social Security and Medicare. But the flip side of that is that if a parent's working for their child, they're not contributing to Social Security and Medicare, which could affect their Social Security benefits when they go to retire at 65 or 67. So that it doesn't count as points in the Social Security system, but taxes aren't coming out of their paycheck. Another thing to keep in mind is if you're receiving any kind of public assistance, Medicaid, food stamps, any, HUD, any kind of public assistance, even though taxes aren't being taken out, that it is still considered income. So it could, if you make too much money, it's going to increase your income and it could affect your public assistance benefits.
Great, and I think we have time for one more. What are the requirements during audits for vendors who provide supported employment?
I think I already answered that one.
Okay, that's what I wasn't sure as I'm reading through.